she made the trip here and from Harrisburg today to talk about some of the health and human service priorities from the Department of Health and the Commonwealth that they're working on. So come on up, Evelyn.
All right. Good morning, everyone. Thank you, Janine, so much for inviting our office to join all of you today. As Janine mentioned, my name is Emily Lebo. I am a Public Health Program Administrator with the Office of Health Equity at the Pennsylvania Department of Health. Been with the office come November, 3 years. Time flies when you have fun, they like to say. But today I'm going to be going over a little bit about our office at first for those of you who may be unfamiliar with us. I'm then going to take a look at some health disparities at both the state and county level. These disparities being discussed are the focus of many of the state and Office of Health Equity level efforts, so you'll see a lot of connections and themes there. And last but most certainly not least, I'll be going over some of the state and community level solutions that have come out of the Department of Health as well as our office. So before I go into our office mission and a little bit of history, show of hands, has anyone heard of our office or interacted with us? Okay, awesome. Well, for those of you who are unfamiliar, we were established in May of 2007 by way of executive order. We are housed within the Office of Operational Excellence in the Department of Health. I like to say we are a small but mighty office. There are about 6 of us on staff, as well as our director, David Saunders. As you can see here, this is our office mission. So through the underlined words, you can really see that the themes of today's conference align very, very closely with what we do here in OHE, as we call it, on a day-to-day basis. So we are huge on advocating for programs and initiatives and organizations such as all of yours here today, really focusing on eliminating health disparities. We're also big on collaboration, so we love to bring together stakeholders from all over the state to really have these much needed discussions and be able to achieve measurable and sustainable improvements in the health status of underrepresented populations across the Commonwealth. So again, this is a visual I'm sure many of you are familiar with, but it's always important to take a look at things from a big picture lens before we get into the nitty-gritty. There is a lot that influences and impacts a person's health. It's not just what occurs in the 4 walls of that hospital, in the 4 walls of that checkup or doctor's visit. It goes way beyond that. As you can see here, a few are outlined through that health behaviors category. It goes into, does an individual use tobacco? Are they able to eat a healthy diet? Are they able to exercise on a daily basis? Do they use drug or alcohol? Then, of course, the clinical side of things comes into play. Are they able to access care? The care they're accessing, is it of the quality that all of us deserve? Then last but most certainly not least, those last 2 there, social and economic factors. These, again, are things all of you who work in these areas on a day-to-day basis. Individuals deserve quality education. We know there is a strong correlation, which I'll get into here shortly, between your level of education and your employment abilities. That ties into income, and if you are going to be living below the poverty line. Do you have the family and social support as you go through treatment for drug or alcohol use, as you go through mental or behavioral health services? Community safety. Can you walk outside your house and go for a walk? Can you enjoy nature? Are there parks around you? That ties in directly to your physical environment. Is the air and water quality safe? Is Is it safe for the elderly and the children to go outside? Then housing and transit. We just heard from Camtran. Is there transportation to get to work? Do you have the transportation to get to your doctor's visits? And do you have safe, affordable housing options available to you? Now we're going to go through some of those state and county level maps and breakdowns for some of these specific health disparities and social determinants of health. Here you can see life expectancy. So there are a lot of great reports and publicly available data that can be found through the Pennsylvania Department of Health. One such report comes out of our very own office, our health equity report. The last one was released in 2019, so pre-pandemic. We are currently working on a new one that will be released in the coming months. But we also have the state health assessment, the state health improvement plan. Those are just some of the resources where this data is coming from. So starting with life expectancy. As you can see here with this map, the correlation, the darker the color, the lower the life expectancy. As you can see, of course, we're focusing on Cambria and Somerset counties today. Cambria, life expectancy, 75.8 years old. Somerset, 77.6 years old. The two darker colors. There's a lot that goes into improving life expectancy. One of those is your poverty and socioeconomic status. So this visual here is a correlation between the rates of individuals living below poverty across the state of Pennsylvania, and the top 5 are through racial and ethnic group breakdowns, then the bottom 4 are through educational status attainment. As you can see, strong correlation between lower educational levels and living below poverty. Huge difference between individuals, the percent of individuals living below poverty who have a bachelor's degree or higher versus their less than high school graduate counterparts. Going to the top then with racial relation, nearly double with the Hispanic population from the overall rating of Pennsylvania, and the Black and African American population is over double. That's a problem. Living below the poverty line can cause issues across a person's lifespan. Are they able to afford transportation to get to work? The work that they are able to obtain with a lower educational level, is it able to provide benefits? Are they able to access quality care? Can they afford housing? Can they afford healthy food for them and their families? This next visual here takes a look at poverty. So we're now breaking it down to the county level. Cambria and Somerset here falls right in those two middle categories. So not doing too bad, but there are still areas to be improved. With just short of 14% of Cambria County between the years 2017 and 2021 living below the poverty level, and for Somerset County, 10.6%. Looking at education. Here again, this is at the state level. This is broken down by race and ethnicity, and again, starting from bottom up, the level of educational attainment. Again, strong correlation here. The Hispanic population in particular, as you can see, both in 2010 and 2021, received less than a high school diploma, a higher percentage received less than a high school diploma in comparison to the overall population as well as their counterparts. Thankfully, you can see here that some of the ratings, like less than high school diploma, for example, across all race and ethnic groups did decrease. Whereas you can see here, very top, the percent of individuals who were able to obtain a bachelor's degree or higher increased. Again, just breaking it down now to the county level. So this takes a look at the percentage of adults 25 and older who were able to obtain a bachelor's degree or higher for the years 2017 to 2021. Again, we did see earlier a strong correlation between the educational level and if the individual is living below the poverty line. Lack of educational attainment, again, is a huge driving force of poverty and unemployment, so it's certainly something we need to take a deeper dive into. Cambria and Somerset County, the lighter the color in this one, the lower the percentage of people with a bachelor's degree. So as you can see, these two counties are on the lower end. Looking at the unemployment map, however, you can see here that Cambria and Somerset County are doing fairly all right in this area, with 5.3% in Cambria County and 5.4% in Somerset. This is interesting for me for many reasons. First one being, even though we are seeing lower unemployment rates in the counties, we were still seeing fairly high rates of individuals living below the poverty line. So what does that mean, right? Where is the discrepancy? Where are these issues stemming from? This is where the concept of individuals being underemployed or the working poor comes into play. These individuals, they have jobs, however, they still are not able to afford the housing they need for them and their families. Maybe that job does not provide benefits for them and their families, or if it does, it's taking up a chunk of that paycheck from them. They're not able to afford food. That then ties in directly to their ability to access quality health care. So here, state level breakdown again takes a look at 3 different areas, whether an individual has a personal health care provider, whether they were unable to see a physician due to the cost, or in general if they are just uninsured. This here is broken down by race and ethnic groups. So as you can see here, the Hispanic population in really all 3 of these categories, unfortunately, is higher than their white and black counterparts, as well as the overall population in the Commonwealth. If an individual doesn't have a personal health care provider, that means more than likely they're not following up on those chronic diseases they may have, diabetes management, cardiovascular disease. If they're unable to see a doctor due to cost, that might also lead them to using emergency care. We're seeing a lot of folks coming into our emergency rooms for issues that traditionally you would go to an urgent care. You'd make an appointment with your PCP or that specialist. However, for folks who are unable to afford it, the ER is their only area of care that they can receive. And then of course, being uninsured. Rural health equity, both Cambria and Somerset are considered rural counties in the state of PA. So again, this information I'm sure is not surprising to any of you. In rural Pennsylvania, the geographical isolation can contribute to a lot of disparities that we see, not just in Cambria and Somerset counties, but in the many, many rural counties in the Commonwealth. We're seeing low primary care physician and overall healthcare provider numbers per the population. Along those same lines, we're seeing sparse dental care being made available, low mental health physician numbers, and then of course, transportation scarcity. Getting into some county-specific data in relation to these areas of quality care. Here you can see this takes a look at the primary care physicians in direct practice per 100,000 populations. So Cambria and Somerset County, second from lowest, 74 and 57. We know that when there are less providers available, not only is that a decrease in access to care, but our community members run into other issues. If they have to travel further to see their doctor, but what if they don't have reliable transportation? What if they miss that bus and they're late to their appointment? That may lead them again to utilizing emergency care because there may be an ER closer than their specialist is located. And then of course, maternal health and birthing center deserts. There are a lot of counties, unfortunately, in the state of PA, I believe 7 or 8 if I'm not mistaken, which is 7 or 8 too many, that don't have a birthing center located in them. That means for individuals who, and soon to be moms who need that care, who need to go and deliver their child, they're traveling miles. They're traveling to those appointments, and again, what if they don't have the transportation? What if it's bad weather outside, right? Living in the mountains, the snow can get crazy, the ice can get crazy. There's a lot that goes into it that we really need to be thinking about so that our organizations can really help improve all the aspects of these individuals' lives. Mental health, similar breakdown here, rate of mental health providers per 100,000 people. Cambria and Somerset counties in the field of mental health is actually doing on the better range. So here, lighter color equals more mental health providers. Cambria County is doing slightly better than Somerset County, but again, poor mental health outcomes, direct impact to physical health, well-being. Substance use. So this takes a look at unintentional drug overdoses per 10,000 by county in PA. So the darker the color here, the higher the rate of unintentional drug overdose deaths. Unfortunately, Cambria and Somerset are on the higher end here, but I like to say knowledge is power. The more we know, the more we can create solutions and have these innovative approaches to improve these individuals' outcomes. People may fall back into using their drug of choice because they are worried about where's their next meal coming from? Where are they going to lay their head at night? How are they going to pick up their prescription? Or how are they going to get to those physician follow-up visits once they're released, let's say, from an inpatient rehabilitation program? If we're able to fix those components, we're able to help them live a healthier and longer life and not resort back to utilizing drugs because to them, it was an escape from reality. We want to create a reality where folks want to be present, or they want to be with their friends and family, and they're able to live their best life. So now I'm going to get into just about 2 or 3 social determinants of health. Again, not news to any of us. These are all areas that you work in on a daily basis. But transportation, again, we just heard a great presentation from Camtran. Here you can see this breaks down the public transportation bus services by county. Of course, we have Camtran, and then in Somerset County, I was doing a little bit of research into this last night. It seems Somerset County has 3 different public transit bus lines, Scoot, Dash, and Cat. I'm correct in that, right? Transportation experts?
In Somerset County, it's a shared ride service. There is no fixed route bus service in Somerset County.
Perfect, thank you for that. Prime transportation example of where individuals, if there's no fixed transportation line or access, they may not be able to get to work. They may not be able to get to the grocery store. That can cause a lot of issues and unfortunately may lead them to living below that poverty line. Access to food food and nutrition. So this takes a look at overall food insecurity rates by county. Again, lighter the color, the lower the percentage of overall food insecurity. So Somerset is doing fairly well in the area of accessing food and nutrition for their community members. Cambria, slightly higher percentage at 13.2%. But really, we all know no one should go to bed at night wondering where their next meal is coming from, especially children. Lack of nutrition, particularly in kids, can lead to a lot of long-term negative impacts on an individual's health. Food insecurity across Pennsylvania was increased during the COVID-19 pandemic due to things such as difficulty finding resources, job losses, transportation, and isolation. During the pandemic, we saw more than 1.77 million Pennsylvanians facing food insecurity during the year 2020. And then last but most certainly not least, housing. So based on 2017 and 2021 estimates, 47% of Pennsylvania residents spend 30% or more of their income on their rent. If they're spending that income on rent, what does that take it away from? Food, transportation, school supplies. We're in back to school season. For those who have kids, you know, clothing, backpacks, all of that, it adds up quick. They will not have that disposable income because they are spending it just to ensure there's a roof over them and their kids' heads. This visual here on your screen looks at home ownership. As you can see here, Black and Hispanic Pennsylvanians have lower rates of being homeowners in comparison to their white or Asian counterparts, both in the year 2010 and then again in 2021. All right, so we went over the health disparities being faced across the state. Now let's get into some of the solutions. First one being the State Health Improvement Plan. Show of hands, how many people have heard of the SHIP? All right, a few. So the State Health Improvement Plan is a 5-year strategic plan led by the Pennsylvania Department of Health. It began just last year again, so this is the 2023 to 2028 strategic plan. It outlines key health priority areas at the state level that need to be improved and worked on over that 5-year period. As you can see, health equity is one of the 3 big bucket areas that a variety of different stakeholders, subject matter experts at the state level, determine need to be looked at further. Along with health equity, whole person care, and chronic disease prevention were 2 others that had some different groupings like physical activity, access to care, poverty, housing, all areas where there are opportunities over the next 5 years for all of us to work on improving them. This breaks it down just a little bit more. Again, you will get these slides following today's presentation. This is also available on the Department of Health website. The State Health Improvement Plan, or SHIP for short as we call it, all of these different goals you see here in gray, though there are groups of individual stakeholders who meet on around a monthly basis to work on this area. So if you see a goal on here that relates to your organization's focus, let's say your group focuses on environmental health and you're interested in learning more about that goal team, please feel free to email me and I'm happy to connect you with that goal team lead. It takes a village, it takes all of us to come together to ensure we are improving the well-being of all Pennsylvanians. And there's so many different categories here with these goal teams doing phenomenal work that we would love to have each and every one of you join, whichever one or more than one is applicable to your organization. Moving on then to community level solutions / Office of Health Equity specific solutions. First one being our Regional Health Equity Action Team. This is an effort that I began when I came on board back in 2021 through the Office of Health Equity, and my new colleague Crystal, who's here with me today, helps me oversee. Again, this is a community level approach group that was developed to really understand the unique needs of each of the various regions, such as North Central, Southeast, Southwest, that exist in Pennsylvania. Populations being served, landscapes being served very differently depending upon where you go in the state. The needs of those living in Pittsburgh may look very different to those who live up in Union County, let's say. Through working with community level organizations at this regional level, help us understand, okay, here's a best practice that's worked for a local organization to help improve food security. Great. How can we support that organization's efforts? We use resource pooling. It's building bridges and really reducing silos to foster local collaboration and organizational partnership. We want to connect all of you at the local level because what I know in Harrisburg about what's going on in Somerset and Cambria County is very, very slim in comparison to what all of you see and work on a daily basis. So we need experts like all of you to join these groups to really help us understand what health disparities are being faced highest by your populations in your communities, and how can we help support all of you at the state level in being able to serve your communities. Some other community level solutions out of our office. This is not an all-inclusive list, but just to name a few, we do have a Pennsylvania faith-based coalition. That means that is a bunch of different faith-based organizations that come together. That is a very important space in the area of health equity. Faith-based leaders are a very trusted community leader for a lot of different areas of the Commonwealth. So bringing these leaders together was very important for us. We also have a Pennsylvania Latina Advisory Committee, again, giving us a deeper dive into that ever-growing community that exists across the Commonwealth. We have culturally and linguistically appropriate services task force, forces I should say. We have an internal and external task forces that meet, really ensuring that we are taking into account the nationally set class standards in everything that we do, whether that's information released from the Department of Health or that's educating community organizations such as your own. Last but not least, I also assist in the overseeing of our statewide Health Equity Action Team group. That is an open door policy group as well. We meet every other Thursday. We've been meeting since, I believe, 2019, before I came on board. But it is where we bring on organizations such as your own to present and share your successes, share your best practices, share what are some new efforts coming out of your organization. And I would say now we have 500 plus organizations across the state on the listserv, and every other Thursday, still to this day, we have anywhere from 95 to 155 folks join us. Great opportunity to build bridges, make connections, and learn a little bit more about what's going on in other organizations and areas of the state. So here's a quote just to close us out. I'm sure Daniel Dawes is not an unfamiliar name for many of you. He introduced the idea of the political determinants of health, so very closely connected to the social determinants of health. But he says here, which goes along very well with the theme of today's summit, we need participation and cross-collaboration among all sectors and their professionals, the skill and breadth of the willing, and the advocacy of the determined. Thank you all so much for your time today. Here's my email. If you're interested in joining any group discussed today, please reach out. If you have any questions, comments, always happy to connect. Thank you.